Hi, this is Dr. Rosenberger at Facial Focus Cosmetic Surgery. Today we have completed a non-ablative laser resurfacing with a 1540 Icon laser skin rejuvenation protocol. We did a complete pass from the angle of the mandible to the submental region, and then superiorly all the way up to the hairline. There are some regions that we cannot get with the laser due to safety, and these regions are going to be at the infraorbital rim, and obviously you cannot laser over the eyes. What do we do here? Well, some options besides surgery is a chemical peel. So obviously we've heated the skin here, we've left this rim that we can't address. So what we're going to do now is we're going to apply a 20% trichloroacetic acid chemical peel to the delicate under eye area to rejuvenate some of this the crepiness and the skin texture of the lower eyelid non-surgically. I'm going to protect the lower lashes. I'm going to start applying TCA. I'm going to feather it. Now she's going to start feeling this start to burn. Is that feeling warm, Rose?
It's tolerable.
Okay. Does it feel hot?
A little bit.
Okay. Okay, keep your eyes closed there. Put that fan on there. So that was one pass. How are you doing?
I'm doing okay.
Okay. You see this subtle frosting that's happening? Compare it to this other side. So what we're going to do now is we're going to neutralize the TCA peel. And this should start feeling a lot better. Is that helping?
Yes, that feels much better.
Okay. So this has been not quite 2 minutes, but you can see this frosting. Sometimes you don't get this with a 20%. With a 30%, it would be all white. You could definitely see where basically that's where the skin has been denatured. All right, so this area is going to turn black, brownish, and then it will flake off. And there'll be nice new pink skin underneath it when it's all done. So we just completed the infraorbital 20% TCA peel on both sides. And I have cleaned off the left side. It's been about 5 minutes. If you want to zoom in here, we can see where you kind of clearly have an area of frosting, and then we carried that frosting out onto the area that was lasered to kind of feather that region and avoid a clear line of demarcation. That'll end up with a better cosmetic result. And so what we're going to anticipate is that the skin is going to peel basically from here all the way around to here and underneath the eyelid. And what that's going to help with is this crepiness. We should get a nice tightening of the lower lid skin when it's all done. So we're here with Rose this morning. She is 4 days 4.5 days post 1540 Fraxel resurfacing of the face, as well as a 20% TCA peel to both under eyes. As you can see at the forehead, we still have a little bit of pink, as well as on the cheeks, above the lip, and at the chin. 1 week post 1540 laser skin tightening, as well as a 20% TCA peel. We're just going to zoom in here. She peeled over the weekend. This is 3 weeks post 1540 fractional skin tightening laser treatment, as well as a 20% TCA peel to the bilateral lower eyelids. As you can see, I'm going to zoom in here. We've got a nice improvement to the lateral crepiness of the skin, overall improvement in the texture of the cheek. Come around to this other side. Same thing here.
Here's our pre-op photo, followed by our post-operative photo at 3 weeks, following 1540 skin tightening laser treatment and 20% TCA peel.